Okay, great. Good evening, everyone. Thank you so much for being here for our Staten Island session of the Health and Hospitals Fiscal Year Annual Public Meetings from the Borough of Staten Island. We are having some technical difficulties with the audio on the YouTube. It is not currently working, but we will upload it as soon as it is, and it will be, the full proceedings will be available when that does occur. Before we start the formal program, I'd like to call your attention. We do have language translation in Spanish. If you require those services, you can call 212-788-3359 for instructions on how to use it for translation. I'm Dr. Vincent Calamia. I'm Staten Island City Council representative for the Board of Directors, and I'd like to thank all of you for joining us and introduce also my colleague, Vanessa Rodriguez, who is the Bronx representative from City Council to the board, and also whom you'll be hearing from shortly, our President and CEO, Dr. Katz. Also on the panel here, we have Blanche Greenfield, who's Deputy Counsel. She'll be our moderator this evening, and Calicia Hercules, who is the Secretary to the Corporation. On behalf of the board, I'd also like to extend our thanks and acknowledge the leadership of our Staten Island Seaview Rehabilitation Center, Matt Levy. I just saw her. Oh, there you go. and Carrie Harewood, who's the regional administrator from Vanderbilt, and the dedicated staff for providing exemplary services to our public health system and the people we serve. Also, we're grateful to Frank Fontano for being here this evening to represent Frank Morano, our newest representative from the City Council. Welcome. And sorry. And again, thank all of you here for your support as we strive as Health and Hospitals to provide equal access to safe, affordable, quality care to all. And now I will turn the microphone literally to our President and CEO, Katz.
Thank you, Dr. Calamia. I'm Dr. Mitch Katz. I'm a practicing primary care doctor, and I'm the proud president and CEO of New York City Health and Hospitals. This is my 8th year here. I'm very proud of our system and proud to be here at the #1 skilled nursing facility, Seaview. Thank you, Matt, and to your staff who every day make that true. I want to thank our board members for coming and the staff who organized this meeting so that we could all be here together. Also appreciate those of you who came to the meeting to show that you care about the public health care system in New York City. We appreciate that very much. My goal has always been to expand quality care for New Yorkers, regardless of their ability to pay or immigration status. And that remains the core of what we do every day at New York City Health and Hospitals. Part of our annual meetings is to review the highlights of the things that occurred in the past year. So our nursing team was able to hire 3,600 new union nurses since March of 2023. We housed 375 of our patients through our Housing for Health initiative. Now we're up to 1,200 patients since the launch. U.S. News and World Report included all 11 of our hospitals in the best hospital list. We are a leader in LGBTQ positive care. All 18 of our facilities have earned their healthcare equality leader designation. Our groundbreaking lifestyle medicine program completed its expansion, including at Vanderbilt, which we appreciate, so that we have it now at 7 sites that serve 4,000 patients a year. We are continuing to provide services at our Asylum Seeker Arrival Center. Our health insurance plan, Metro Plus Health, continues its membership across the 5 boroughs. Our healthcare program, NYC Care, for those who are uninsured, celebrated its 5-year anniversary with over 125,000 members. We performed over 10,000 scans for lung cancer. We opened 20 new wellness rooms. Our arts and medicine program continue to beautify our hospitals and create spaces for healing and reflection. Our 250 community health workers have worked with over 25,000 patients, and we even have our own podcast. But we are here today at Staten Island. We're particularly proud of Seaview and Vanderbilt. Seaview consistently earns 5-star ratings from the U.S. Centers for Medicare and Medicaid Services. The U.S. News and World Report released its 2025 Best Nursing Homes in America. Seaview received high-performing ratings in short-term rehab and long-term care, a designation held by only 3% of the nation's nursing homes. Seaview is also expanding its volunteer program and is partnering with CUNY College of Staten Island to allow students to fulfill their clinical rotations for disciplines in social work and nursing. And over at Gotham Vanderbilt, past March, the site established a partnership with the Staten Island Performing Provider System to enhance access for our patients with asthma. In September, the site was recognized by Councilmember Hanks for its work in the community. Vanderbilt has expanded its substance use and dependency program, and the American Heart Association gave it its recognition for blood pressure, diabetes, and cholesterol control. Very impressive accomplishments. I want to mention an issue that has come up at some of our other town hall community meetings in other boroughs. We are working with NISNA and with DC 37 to resolve a challenging issue about how we deal when there are unexpected call-outs among our staff. We absolutely want people to take sick leave when they're sick, and the city provides ample sick time. What's more challenging is when people are out unexpectedly, it puts a greater burden on the people who are at work. And we want to make sure that we have a system that works for everybody. We're currently in negotiations with NISNA and DC 37, and we hope to be able to resolve the situation soon in a way that everybody feels good about. So with that, I'd like to proceed to the main purpose of tonight's meeting, to hear from members of the community. We appreciate your input, and I'm now going to turn to our Deputy General Counsel, Ms. Blanche Greenfield, to outline how the rest of the evening will go.
Good evening, everyone, and welcome. Before we start the formal program, I'm going to remind you once again that we have language translation services available in Spanish. And if anyone requires translation services, please call 212-788-3359. And thank you, Dr. Katz, for the handoff. As Dr. Katz said, my name is Blanche Greenfield, and I am a Deputy Counsel in the Office of Legal Affairs for New York City Health and Hospitals. This is the fifth in a series of 5 meetings conducted annually across the city's 5 boroughs. The purpose of the annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, as well as to afford the public an opportunity to present oral and/or written testimony concerning our performance. Public testimony, both oral and written, will be transcribed and forwarded to all members of the Board of Directors for their consideration. I ask everyone to please note that registration for testimony has now closed. I will moderate the balance of tonight's meeting, during which members of the public are invited to share your comments and concerns about New York City Health and Hospital. At this juncture, I will briefly highlight the format and rules for the testimony. The most important point for everyone to understand is that members of the Board of Directors are here to listen to you and not to engage in a dialogue. This is not a question and answer forum. In order for each registered speaker to have an opportunity to testify, registered speakers are allotted 5 minutes of speaking time. On the podium is a timer that will provide warnings about the expiration of your time. A yellow light will indicate that the speaker has 2 minutes remaining in their allotted time. A red light will signal that the speaker's time is elapsed, and a flashing red light signifies that the speaker has exceeded their time allotment. If you do not complete your comments within the allotted time and you have a written statement that constitutes your full remarks, you may submit your full comments to Calicia Hercules. Your written testimony, along with the transcript of your oral presentation, will be shared with all members of the Board of Directors. And kindly note that there is no transferring of time from one speaker to another. Finally, I apologize in advance if I mispronounce any of the names of the speakers. I ask that you please correct me if I do so. I thank you for your participation, and we look forward to hearing your views. We will now hear from the first presenter, who is Julia Semenkina, a registered nurse and NISNA member from South Brooklyn Health. Is Julia here? All right, let's go to our second speaker, Ray Briggs, RN. Let me fully introduce you. Okay, Ray Briggs, RN and LBU president. Yeah. I have one job. You have to let me do it.
Thank you. Go ahead. Yes, thank you for your introduction. My name is Ray Briggs. I'm from South Brooklyn Health, LBU president. I always follow Dr. Katz because I want to know his vision. I have strong confidence in Dr. Katz, and over the years, since I've came back from the military, I've been following Dr. Katz's agenda. And what I like with Dr. Katz, he's very malleable in terms of his approach to the vision of H&H. So far, he's doing things right. He's trying to automate H&H to the new age of AI. He's also trying to make certain that staff get a fair share. Also, he's trying to make certain that his community get the right services. I'm very impressed with his leadership, and I could demand nothing better than have Dr. Katz at the helm. We know our problem in H&H is that some people, to my mind, don't really try to follow his vision. And what they try to do is overstep our present potential, and they try to do more. And as a result, I find some very negative things in the media, very troubling things in the media that tend to stain H&H. And as a result of that, it tars Dr. Katz's reputation. And I would just like everybody to understand this, that we are not as good, all of us are not as good as the amount of negative publicity that's out there. It's added stress and burden to us. And there's a disenfranchised right now in terms of the negative publicity, plus with the sick leave policy, the nurses them are disengaging from H&H tremendously. The new nurses don't understand what is really happening. They're just like a deer in the headlight, you know, they're all confused. I'd like to thank Dr. Katz for bringing this up with NISNA and DC 37, and I hope the policy remains the same. What we can do very well is try to maybe offer some monetary incentive at the end of the year for those nurses that show commitment, undying commitment towards preserving or using the sick leave time very very good in terms of enhancing the potential of H&H. So Dr. Katz, with that, I would also like you to understand that we need staffing with the AI technology that's put in place, tremendous burden as well. AI technology in nursing is different from the AI technology in other industries. We need staff to go with it. So with that, I will just leave you alone. Thank you very much, Dr. Katz.
Thank you very much for your comments. We appreciate it. And our next speaker is Pat Harris, a registered nurse and also a NISNA member. Welcome.
I am not a registered nurse.
Okay.
I'm representing the RNs, and I work with them, and I've been around and a long time away from the bedside. But I'm here to just make sure that I say hello to Dr. Katz and all of the board members. We are glad that you do have this opportunity to come and listen, and that we get that opportunity to use this forum. We've tried to come to every single meeting that you've had to make sure that you know what we're talking about. And I'm convinced that you know. We are just not convinced that we've gotten the best answers yet. And we know that you're working with NISNA. We know that you're working with DC 37, who's recently joined I want to call it the protest, but whatever it is, has recently been listening to what the problems are. Let me just say, I've been to a lot of university graduations, and the only thing that I can say to you is whenever the nursing school is mentioned, they scream, they holler, they throw their hats higher than anybody because they've worked so hard to become an RN. To me, they get to the job. You've hired, like you said, this year in H&H, over 3,000 nurses. I'd like to know the number of how many of them stayed. They get discouraged very easily because of the staffing. We don't have the right training. We don't have the right supervision, and they are complaining. I hear the complaints, and there are many who have left before they get through the orientation. Well, I'll say they get through the orientation, but not through their probation. So I would love to get that number, and I certainly don't have it. But I know in the facilities that I work in, I know that I've seen them walk out the door, and no matter what we said, we couldn't keep them. So I want to know that, and that is the problem. Safe staffing saves lives. We know that. Everybody knows that. And as Mr. Briggs said, you can't get rid of the nurses. You can't do this job without. H&H wants to go through for excellence. You have to have the nurses, and you have to have enough nurses. It's not only the nurses that complain, because many are quiet. Many are quiet. So this whole idea of how they use their sick time, first of all, the new nurses don't even have any sick time acquired yet. They don't have any vacation time, and they get sick too. I've dealt with some that had accidents and say, who's going to pay me? Because they have nothing to gain in that first year of probation. So I say all of these things to say, nobody likes being called in the back room to be talked to about anything. Sometimes you have to. Sometimes people need counseling, but nobody wants to. Even though we say these 3 write-ups or whatever are not disciplinary, you tell me who doesn't feel disciplined when they got to be called into the back room with a supervisor. It is that way. So I am here to make sure that you know we have not given up. We are not going to give up, even though this is the last meeting. We've got a plan how we can get the forum to talk to you more, to make sure you understand. And we need different answers. We want something in writing, very clear, to say the policy, and that it hasn't changed in the last 40 years. What can we get in writing? And now that I'm talking about writing, we need our contract book. Why doesn't NISNA have the solid hard copy contract that was negotiated almost 3 years now? The book's going to be expired again, and we're still using the one that expired 3-4 years ago. So please, please, that's an additional thing that we're thinking about and looking into, and we want to know, what are we doing? Why don't we have a document that we all agree on so that we could talk about policy and not change and so forth? I wanted to make sure that you know we're not giving up. So I hope that you hear, you listen, and I know you've listened to Mr. Briggs before, and I just hope that we can do something about it. The nurses are exhausted and tired, and they don't want to come to work sick, and they don't want to be counseled every time. They have to have an unscheduled. We believe that the problem with unscheduled, where's the float pool? Where are the people? Management has to know that somebody's going to get sick. And therefore, there should be some budget applied to keep some people there, not the ones you have to call in that worked 12 hours the night before, whatever. You need to have people that you can depend on, that are part of the float pool, that are properly trained to do the job, so that we need them. Thank you all for.
Thank you very much for your comments. Thank you. Nobody else? Well, we have no further speakers for this evening, so that this ends our formal program. Thank you all for coming.
Thank you.
Thank you.